Okay, good evening, everyone. It's my pleasure to welcome you to this Zoom meeting tonight. The discussion tonight is for those who are interested in coming to the UK to work as healthcare workers. At our last Zoom meeting, we explained that the UK government is allowing a group of professionals to come to the UK to take up employment. And let me recap what the program is about. If this is the first time you are attending this Zoom meeting, or if you've not been able to read some of the publications from Newsband, the UK government announced what they called healthcare visa for those who are coming to the UK to take up employment. And the certain group of professionals are highlighted. Let me get the list of the professionals which the visa applies to. One second, let me get the list. All right, the opportunity applies to those who have qualifications in the healthcare services, public health managers and directors, residential day and domiciliary care managers and proprietors, biological scientists and biochemists, physical scientists, medical practitioners, psychologists, pharmacists, ophthalmic opticians, dental practitioners, medical radiographers, pediatrics, health professionals, physiotherapists, occupational therapists, speech and language therapists, nurses, midwives, social workers, laboratory technicians, paramedics, dispensing opticians, pharmaceutical technicians, medical and dental technicians, health associate professionals not elsewhere classified, nursing auxiliaries or healthcare assistants, Nigeria call them auxiliary nurses, dental nurses, senior care workers. Newsband have received lots of inquiries from other professionals asking whether they are qualified or not. So the point is, unless your profession is listed, this is an exhaustive list. So unless your professional is listed here, then of course, this British health and care visa scheme does not apply to you, even though there are maybe other schemes that you can tend to apply to come and work in the UK. But this particular health and care visa only applies to these standard occupations. Now, what Newsband is doing, it's simply to provide information. And at the end of this program, in the next 5 to 10 minutes, you are free to ask your question. Newsband has also obtained partners with which they are associating to make this offer available to people who want to come and work in the UK. But at this point, Newsband is only concentrating in those who will come and work to the UK as nurses, midwives, or healthcare assistants. Obviously, there are other opportunities for if you are, for instance, a biochemist, a microbiologist, therapist, and so on. They can also provide that assistance maybe in the next 2 weeks or so, but at this point, they are concentrating on these three professions: healthcare assistants, nurses, and midwives. They will provide an email where you can send your CV if you want their assistance. And then if they look at the CV and feels that you are qualified or you stand a chance, then of course they will contact you. Please bear in mind that their assistance is limited to helping you to identify medical companies in the UK or health companies in the UK with the license to give you certificate of employment, and then assist you to do so. But they are not guaranteeing you that they will give you visa. They will simply help you towards making this application and then getting certificate of employment, because the basic thing in getting a visa to come to the UK, the most important thing is to get this certificate of employment, and of course, make sure that you have an international passport. Now, questions have been asked as to whether what level of assistance are they able to provide. So let me quickly run this through about how you can come to the UK. If you want to apply as a healthcare assistant, what exactly are you supposed to do? It's very simple. For you to come to the UK to work as a healthcare assistant, you don't necessarily need loads of qualifications, because most of the caregiving jobs come with on-the-job training and close supervision. So it doesn't really matter what qualifications you have, whether you're a doctor or a nurse, or whether you have a degree certificate or not. So whether you have all those qualifications, you can still apply to come to the UK and work as a healthcare assistant. However, if you have either of these qualifications, then you stand a very good chance of being offered a job. You can have a care certificate qualification, which you can obtain from Health Education England approved training organizations in the UK. You can have a diploma in health and social care, or you can have a GCSE at grades 9 to 4, A to C, which means if you have a WAEC certificate, that will be enough. WAEC or senior school certificate or equivalent healthcare qualifications. But that is only limited to coming to work in the UK as a healthcare assistant. Apart from that, there are no mandatory requirements for you to work as a healthcare assistant. But then if you want to come to the UK, whether you are coming from Nigeria or any one part of Africa or outside Europe, you definitely need a visa. Even now that the UK is no longer in the European Union, even if you are coming from another European country, you need a visa. There are various types of visa available, but for this visa rule, for this route we are talking about, the best visa for this rule is health and care worker visa under the skilled worker visa, formerly categorized as a tier 2 visa. Now, a health and care worker visa permits medical professionals to come and stay in the UK to work in audit social care. You can work with NHS or with the nursing agency and NHS supplier. This means that you can always go to NHS website and look out for health assistant roles being advertised or in adult social care, so that your potential employers that are in hospitals, nursing homes, companies that provide in-home health care can contact you. But then, for you to get this visa, you need the following. 1, you must be able to demonstrate proof of your knowledge of English. 2, you need a valid passport. 3, a job title, and there is a minimum annual salary. When you are applying, the jobs occupation code for nursing auxiliaries or healthcare assistants is 6141. And then the name of your employer and their sponsor license, which should be in the certificate of sponsorship they're allowing you. The minimum salary is £20,480. So how does this visa last? The visa can last for up to 5 years, considering the number of years you pay for when making your application. But you have the opportunity to extend or update your visa when it expires, or if you get another job or employer. To emphasize or to repeat, those who qualify for a health and care worker visa are likely to be a doctor, a nurse, a healthcare provider, adult social care professional, or someone working in the health and social care sector. I've said before, you need a certificate of sponsorship from a UK employer before you go and apply for this type of visa. And your employer must be someone who is approved with a license to give this certificate of sponsorship. If you have an employer that doesn't have a license, you can simply ask him, okay, suppose you have someone to help you to obtain a license, what will happen? We have a law firm that helps UK employers to obtain this license and be able to pay to give you a certificate of sponsorship. If they want to apply for this license, we can help them to do that. They only need to pay the Home Office only £536 and then apply and get this license. But for any employer to give you this certificate of sponsorship, they must have a license from the Home Office. If you already have an employment offer, then your employer will make sure you meet the eligibility requirements, which is this certificate. For you to demonstrate your knowledge of English, you must be able to understand English up to a minimum of level B1. You have to take this examination, IELTS test. Then, of course, when you are going for a visa, you must be able to demonstrate that in your first month in the UK, you have enough money in your bank account to support you until you get your first salary. And so they expect to see in your bank account £1,270 to support yourself for a month when you arrive in the UK. If you have a wife and children, then your wife and children can also get a visa once you have this health and care visa. They can also give visas to your wife and children, or if you're a wife, for your husband and children to be able to accompany you. If you're a wife, you have to demonstrate that you are married or that you have lived for a certain number of years. You must not have a criminal record. So you have to obtain a certificate from your country to show that you don't have a criminal record. If you are over 27, you need a certificate from any country you've lived in for the past 10 years. If you get your qualifications from outside the UK, you can send it to the UK NARIC, National Academic Recognition Information Center, to certify their equivalent certificate in the UK. If you want to go through that route. So, if you get stuck or make a mistake, you can seek professional help from a visa processing agency, and that is where you need to pay a fee. All this information we are giving you is available out there. But if you want someone to help you to do that, then we can link you up with an agency that can help you with the application. I think one they take, if we just to help you, to assist you, there is a different types of fee they take. I think what they're asking for is 20,000 naira. If you want them to assist you to make that application, to just simply get that certificate of sponsorship. If you want them to assist you up to visa level, it has a different fee. If you want them to, I think they're still negotiating with a company that will be able to employ you directly and give you the certificate of sponsorship without going through the rigmarole. That one also has its fee. So you will get all this information when you contact them with the email address that we are going to provide. Then my job here tonight is simply to provide information and give you the link for it to continue. Now I'm ready to take your questions. You can indicate and raise up your hand using the device. Yes, Anyanwu Theophilus first. Please unmute yourself and ask your question.
Okay. Good evening, sir. Yeah.
Go ahead.
Okay. My question is, somebody I read human anatomy. Is he qualified to apply?
You see, my problem with this is that the list I read out, the Home Office guidance says that this is an exclusive list. So when you say human anatomy, for instance, let me emphasize again, there are other rules. There are other routes you can take to come to the UK with your qualification. They have their, what they call it, higher skills visa, which replaced the Tier 2 visa. But for this particular health and care workers scheme, the guidance is that the list they have listed here is exclusive. So unless it comes within that list, So when you ask me now, when you ask me whether human anatomy, someone who qualifies in human anatomy qualifies, my answer will be that human anatomy, I don't know whether it is listed here, but then there are other routes that you can take. Unless human anatomy comes under, there are two headings that we says health professionals not elsewhere classified. So if we can say, if there is no other route which mentions human anatomy professionals, for instance, so you can argue that human anatomy can come under health professionals not elsewhere classified. And then of course, but then I'm not, I don't work in the home office, so I will only go with the information that I've provided to the public.
All right, so no problem.
Yeah.
I got you.
But if, like I said, human anatomy, there are other routes and there are other agencies that can help you with that route as well, if that is what you are interested in to do. So thank you. Next, Abe, please. You can unmute yourself.
Okay, sorry, I'm trying to, my phone is locked, sorry. Hello, good evening.
Yeah, go ahead.
Okay, good evening. My name is Abe from Lala. Sorry, I want to make inquiry concerning, I'm a dental technician and I also have a certificate dental technician. Then I also have a certificate for community health assistant. So I don't know what are the requirements for me to move to practice as a dental technician in UK or to practice as healthcare workers over there. And sorry, I've joined the Zoom since like 4:30 or 4:50 there, but I didn't hear when you were mentioning some courses that is available.
Okay,
That
like I said, when I was answering the guy that asked about human anatomy,
okay.
If you have a qualification in human anatomy, for instance, and you want to apply to come to the UK through this health and care visa scheme,
Okay.
bear in mind that you must get a job not as a human anatomist, or I don't know what they call themselves.
Yes.
But you can only apply to come here as maybe a healthcare assistant.
Okay.
Or that is because they said that this list I gave here it's exclusive. So unless it comes within one of the items listed here, then of course this
is
health
there.
and care visa scheme,
I think I heard dental. You call
then
dental.
Good, then it is there. Then yeah, I can see dental practitioners. So if you are a dental practitioner or you have qualification, then of course it is there. The problem is this, that with the agency I'm working with, they only give certificate of employment to either nurses or healthcare assistants. That is, it is very limited. However,
okay,
they can give you information about those who will employ you as a dentist. But that is not, it is not them giving it to you, but they can assist you. They can tell you, for instance, okay, these are a list of 10 companies that can employ dental practitioners. All right. But they're not giving you because it is not within their own remit. They are not giving you the guarantee that those dental companies can give you a job. But then the point is, before they give you those lists and information and to start assisting you, you will have to pay them. But then if you pay them, it comes without that guarantee that they will give you if they are going to employ you in their own company. I don't know whether you understand the difference.
I understand. So how are we going to get the agent details?
I will give the email address now.
Okay. Thank you.
Someone is asking, must I have to pass the IELTS before applying? No. You need the IELTS when you are going to apply for a visa.
What is the band for the IELTS, sir?
I think the last time I explained, you must have to get up to 6.5 for a nursing. I think for nursing and midwife, I think it's 7.0. But then if you get, I think 7.0. But I think if you get 6.5, then when you are going for, I think they will still give you a job in that field.
So what about the healthcare giver? What band for healthcare giver?
Are you talking about nursing band or the grade you will
No.
achieve?
Caregiver.
Are you talking about the passing grade you will attend in IELTS
Yes.
Look,
Band.
I think it should be 6.5.
Okay.
I wouldn't want to mislead you. I'll have to come because this information I won't put everything on my head, but I can check and then get the band for you. It's also available on the internet on gov.uk website, but I can check and confirm.
Okay.
But right now, because I'm talking, I'm not free to go and start checking now, unless we have to later. If you contact us, if you contact me later, yes.
Okay, thank you.
Right. Next hand, I have Ndubisi Njoku, please. You can unmute yourself.
Good evening, sir.
Go ahead.
Good evening, sir. Can you hear me?
Yes, I can hear you.
All right, sir. Last time I joined the last meeting, I'm opportunity to join this one again. Please,
Yes.
What is the technician code if somebody is applying? Laboratory technician.
I have to check it. I don't have it in my head. I can check for you, but I don't have it in my head.
Okay. Another one is, which one comes first? Is it the IELTS exam before certificate of sponsorship? Which one comes first?
I think the most important thing you need, the first should be certificate of sponsorship, because I wouldn't see where, if I'm giving you a job, for instance, what I will check is the skill. So the first thing is certificate of sponsorship. You will need IELTS when you are going to apply for a visa.
Okay. So how do we get the certificate of sponsorship now?
It depends. I think what's delaying it with the people I worked with, I gave contact with the last time, is the issue of there are certain structures they need to put on the ground, which I'm sure will be okay by next week. So if you have already sent your CV and they look at your CV and feel you are what they are looking for, then they should be able to contact you. I can get the, let me post the email address again. If you haven't sent your CV, then do so. If you have, then simply wait for them to contact you. I don't know whether I'm making sense.
Okay, just send it.
Let me provide the email address again. Just send your CV to them. They will look at it, and then they will be able to contact
you. Okay, sir. Thank you.
1 second. Yeah, newsbandtv@gmail.com. That's correct.
Is it on the screen?
Let me send it now. newsbandtv@gmail.com. Next question, Thompson.
Okay, thank you.
Cheers.
Good evening,
Thompson,
sir.
Go ahead.
Good evening, sir.
Good evening.
Yeah, thank you very much for what you have been saying this morning. My question is that the first one, you talked about the criminal certificate. My question is that. My question is that, or my research. For example, if you have not traveled out of a country before, is it still necessary to get the certificate of the criminal certificate? Because I saw that once you travel from Nigeria, for example, from Nigeria to another country, whether Dubai or other country, it depends on your stay there that you you need to provide a criminal certificate. But if you have not been traveled before, you are here in Nigeria, so is it compulsory you must provide criminal certificate? That is my question number one. Then question number two, if I'm applying, is there any packaging for the family? If I go with your family and children, are you going to include them on your application, or they are going to apply separately? That's my second question. And are they going to provide accommodation if I have been chosen? Because definitely, I saw one person £270. That is minimum of amount you must get to your bank account for other expenses in UK. So does that cover accommodation, or the employer will provide the accommodation for you? So that's my question for me.
Well, my understanding, unless the employer offers accommodation, I don't expect the employer to provide accommodation for you. That's one. And then the other question is with criminal.
Sorry, come again.
Unless the particular employer offers you
Okay.
accommodation, accommodation does not come with an offer of employment in the UK.
Okay.
So that means once you get the visa, you have to arrange for the accommodation yourself. And then secondly, with regards to with regards to police clearance, the information they are providing is that you have to show evidence that you don't have a criminal conviction from the country where you have lived for the past 10 years.
Okay.
With regards to coming with your family, if you are, once you get the certificate of employment and you are going to apply for your visa, you have to indicate whether you are traveling with your family or not, who are traveling with you. So if you're a husband, you have to say, I'm traveling with my wife and my 2 children, and provide their passports as well. So they will be given visa as your dependents. That's the way it was.
Thank you very much, sir.
Thank you. That's Thompson. Jennifer, please. Go ahead.
I studied in junior community health. I want to know if I'm qualified for the healthcare workers visa.
Sorry, you studied where?
Community health, junior community health.
Yes, if you are applying for visa as a healthcare assistant, you don't really need any professional qualification to come and work in the UK as healthcare assistant, because if the company employs you, they are going to provide needed training and you work with close supervision. So that means even if you have only a work certificate, you can come to the UK and work as a healthcare assistant. However, when you have a professional qualification, it enhances your chances of getting that employment, because view it as you're applying for a job, and maybe you are not the only person applying for that particular position. And imagine where one of the applicants has a nursing qualification. Okay, good night. So imagine where one of the applicants have a nursing certificate and you only have a work certificate. Then of course the employer would like to employ someone that has a nursing certificate ahead of you. So that's why I'm saying, yes, without any certificate or qualification, you can come and work in the UK as a healthcare assistant. But then when you have those professional qualifications, it enhances your employability or your chances.
Thank you very much, sir.
Right. Stefani, please. Please unmute yourself. If I Charles Mark.
Yes, good evening.
Good evening.
You are doing a great job here. Thank you very much. My my question is someone who has an HND in environmental health technology, and a BSc in health education. Is he suitable for the healthcare assistant cadre?
Please ask your question again.
I said someone who has a HND in environmental health technology and BSc in health education. Is it
Correct.
suitable?
I think health education will mean that it's not health education will mean that it's an education. How do I put it? What do you call it? It's an education faculty or education department, not really healthcare department. Am I correct?
They are in healthcare department. The person is currently working in healthcare department as they are given in Nigeria here. They are called health education officers in health.
So what I'm asking it is, it's a health education. It's an education field, not really a health practitioner. Am I correct?
Currently practicing as a health practitioner. Currently a health practitioner.
Okay, it's a health practitioner. Then of course that means he can apply to come and work in the UK as a health practitioner as well. So I can show.
What of the health?
Sorry.
What of the health assistant cadre? Can
Yes,
the person be suitable for that?
Yeah. Like I said, you can come if you are coming to work simply as a healthcare assistant. It is just like applying to a hospital to work as an auxiliary nurse. You don't really need any particular high qualification to do that, because when they employ you, they will give you the training you need and you work under supervision. So that means whatever you read, you can apply to come and work as a healthcare practitioner, but they have to look at your skill set. It's just like when you provide them a CV, there is a certain type of skill they are looking for. There is a level of experience they are looking for. So it's for that employer to say, you have this set of skills, which I think will make you to be a good healthcare worker. And bear in mind that when you're applying for work in the UK, there is something they are looking for. And they view it as a job. So unless you like to do that type of job, unless you like to work as a healthcare assistant, you will not really do well in it.
Okay.
So don't jump into it to say, oh, this is an opportunity for me to travel to the UK. Because if you come, it is only that job you will do. You cannot do any other job unless you want to stay to go and become an illegal immigrant. But if you're coming to the UK, you are only coming to work as a healthcare assistant and nothing else. Therefore, you must decide for yourself that, look, I want to be a healthcare professional. And so your employer will look at your CV and see that you are someone that could work as a healthcare professional before he gives you that job. But prima facie, like I'm saying, on the face of it, yes. No matter your qualification, you can apply to come as a healthcare assistant, even if you only have a primary school certificate. But it depends on the employer to look at a CV and say whether I would like to employ someone like this to come and work for me.
Okay.
I'm seeing some questions on. Let me read the questions on the chat. Maybe it will answer questions that people are already asking.
All right.
The requirement that applicant must have a current professional registration is applicable to almost all positions. How do one get that? Not necessarily. Let me give an example. If you are a qualified nurse in Nigeria, then you have to apply to Nigerian Nursing and Midwifery Council, I think. You have to verify your certificate. Once you can verify your certificate, it puts you in a good stead to apply to come to the UK and work as a nurse. So that Nigeria verification is enough for them to look at you. Even if when you come here, you will still have to do some training and pass a certain exam. So I don't understand this question from Victor that asking whether you must have a current UK professional registration. No. Otherwise, what they are employing you because you qualified in Ghana or Nigeria, for instance, and not because you qualify in the UK. So it doesn't apply. The next one. Yes, if you have the Nigerian registration by NMCN, of course, that is the first step. If you want to come to work as a nurse or a midwife, remember it's different from coming to work as a healthcare assistant. So if you want to apply to come and work in the UK as a nurse or as a professional nurse or a midwife, then of course you must be registered first of all with Nigerian midwife NMCN, first of all in Nigeria. That is the first thing you do, because it is that body that will verify your nursing qualification. before you even think of applying to be recognized in the UK as well and then applying to come as a nurse. It's different from simply coming to work as a healthcare assistant. Someone say he need procedures and all necessary tests to proceed with the company's assistance. Then I have provided a WhatsApp contact number and an email address. And some people are asking, they have provided this, they have contacted the number, and nothing have been happening. So I said by next week, if I send your CV to this email address, they look at the CV and start contacting those they wish to assist. So send your CV to that email address if you want the assistance of the company. I have provided the email address up there. Just scroll up, I can provide it again. Then the WhatsApp number. I hope I sent to everyone. No, I think I sent to an individual, sorry. To everyone. Under the contact number to everyone. Next question, Chu. Oh, Chu, I think I'll lower your hand instead of asking you to. Okay, Nkechi, please. Nkechi, can you unmute yourself?
Good evening.
Good evening.
Most of my questions have been answered. You just answered the question.
Very good then. So let's go to the next person.
Mm.
We have only 10 minutes remaining.
Hello, sir. Hello, sir. Hello.
Go ahead.
If it's true, I'm so sorry because you said you could. I'm so sorry. I'm sorry. I'm shouting. My question is, I'm sorry. Good evening, everyone. My question is, for example, number one, you know the company that is supposed to give you a certificate of sponsorship.
Yes, go ahead.
How much is the certificate of sponsorship, and is it something you can pay as an individual to the company to help you?
You will get a certificate of sponsorship from a company that has offered you a job.
Okay.
So that certificate of sponsorship simply means that, yes, we will employ you if you come to the UK, and we are giving you this numbered code as evidence that we will employ you, because you need that code and information contained in it when you are going to apply for a visa. So you will not pay for that certificate. The payment you are making is only to the people assisting you to make that application. You can as well take the information I'm giving you here and simply go and find a company and apply for yourself. That is free. But you are only paying the 20,000 naira for the assistance of the company assisting you to make that application.
Okay.
Bear in mind, it is not for visa. If you want the assistance of a visa agency, it's a different fee. This is simply assisting you to make the application, give you the name of the companies you will apply to, and give you the information, assist you to apply to that company that will give you the certificate of sponsorship. You can go and do it for yourself if you want.
So I have a question. So what if you have a company, or you're friendly with one of the managers of the company here, but the company doesn't have a certificate of sponsorship? Can you?
It is a UK-based company, not the company. Are you talking about a UK-based company? It is only a UK-based company that will give you a certificate of sponsorship to say that
yes,
we will
of course,
employ you.
I understand. So if the UK-based company doesn't have a certificate of sponsorship, however, you are friendly with one of the managers or one of the people who own the company, and they don't have money, or is it something you can pay on just to help them, just to help yourself?
If the UK company doesn't have a license to issue a certificate of sponsorship, it doesn't matter whether you're a friend to the manager or not. Everything is done in a very transparent manner. So it is not every company. There are companies.
I thought you said it was £536 for the certificate of sponsorship.
Okay, no. I said if that company wanted to employ you, but they do
Yeah.
not have a license to apply for the certificate, to give you a certificate of sponsorship. They can
Yes.
apply to the UK for the license, and the cost of that license is £536. That is the fee you have to pay for. That company will pay to the Home Office to apply to be given a license to give you a certificate of sponsorship. It is the Home
Okay.
Office fee. Yeah.
Are there any other additional costs that are associated with that fee?
You
With
mean
that
for?
certificate of sponsorship, sorry, apart from the £536 that's being paid to the Home Office.
Do you mean for the company?
Yeah, for the company.
Because it is not you that's paying that fee. Are you clear about that?
No, of course I'm clear about that. So it's just £536 that the
Yes.
company needs to
If
pay
the
the Home Office.
if the company wants to apply to the Home Office, the only fee that company will pay to the Home Office for a license, and of course there are a list of things they need to do. I think there are about, I have the list. For instance, I have helped a company to apply for that license. So
Okay.
if the company wants me to help them to apply for that license as a solicitor, my fee is separate.
Okay.
But if he wants to apply for himself to the Home Office to get that license, the only fee he will pay to the Home Office is £536 and no other fee. There's no hidden cost.
Okay. What are the conditions for a company to have before they can apply
Do you
for
have a
certificate?
company? Do you have a company? That's
Me,
a
no.
different topic. That's a different topic you're going into.
Yeah, I just want to know if the company that I told you that I'm friends with
Like
somebody who.
if that company contacts me, then I will give them that information, but not on this program.
Okay, no problems. Another question I have is there a discriminating factor? Sorry, is age a discriminating factor when it comes to application?
No, age doesn't matter. They will not even ask you your age.
So it doesn't matter if somebody who is in their 60s, for example.
No company employing you asks you their age, your age in the UK. If they does, we call it age discrimination.
That's what they will say. But when it boils down to it, they consider that, especially when you're going to be sponsoring somebody from abroad. You know,
well,
they want someone who is who is willing to work a longer time.
They will not tell you, but they will not tell you they didn't take you because of age.
No, they won't tell you, but it is something
Yeah,
that. So I'm just
of course,
that
stealing armed robbery is a crime. Does it mean that some people who doesn't go and commit armed robbery?
Okay.
Yeah, so they shouldn't. That's the standard answer. Age doesn't matter. But if someone, that's his business. But the answer is that your age does not matter.
Okay.
When applying for a job, yeah.
Okay, so another last thing is, would this recording be available to us upon request or?
Yes, this recording is being streamed live. I can provide the link. If you contact me, I'll give you the link of this recording.
How do you contact you?
It's on YouTube. Okay, I can get it now. It's on YouTube already.
Okay.
I can give you the link now. Sorry, there is a link for everyone. Okay, let me see whether there is any other question on the chat room so that it may answer questions for those who are raising up your hand.
Thank you.
Thank you. If one graduated in biochemistry but have over 20 years in health, safety, and environment, and PG in diploma health safety, you are talking about health safety. No, we are talking about healthcare professional. Like I said, that doesn't mean
sponsorship is not difficult now to get.
That doesn't mean if you are a biochemist with experience in health safety management and environment, you can apply to come to the UK through other routes. But if you're applying through this route of healthcare visa, it's only for those who want to come and work in the UK as a healthcare practitioner. If you don't have the qualification, I think I've explained that. If you have submitted your CV and you have not responded, I say they are trying to put certain things in place. So by next week, they will start contacting those who have sent their CV. Does Newsband already have partnership with care homes or employer with CAOs? Not yet, but hopefully that one is in the pipeline, according to Osofia. Maybe in the next it takes 8 weeks for the application for that license to be approved. So possibly in the next 2 months, there will be that partnership, but not yet available at the moment. Next question. Roberto, please unmute yourself.
Hello, good evening.
Good evening.
Yeah, I studied biochemistry and I've been working in pharmaceutical company for years now. I want to know if I am eligible, and if yes, where can we get the list of organizations that one can apply to?
Yes, if you have this qualification and send your CV and need a list, because to get this list is hard work. So if you are willing to pay for this, just that 20,000 naira for a list of all the companies that can employ you in this field, then they will be happy to provide it for you and then give you further information that you need. But it's not something that I can provide at the moment. But that list is available. This list is up to 50,000. I have seen it. I've seen the list myself. So where you have up to 50,000 companies that can give foreigners job in the UK, that have the license to employ foreigners in the UK, then you can know that it's a hard job to go into that Excel sheet and start picking those particular fields, those who will employ biologists, those who will employ technicians, those who will employ IT specialists, and then getting their contact details, their phone number, their email address, and giving it to you. That's why you are paying. That's the services that you are paying for.
Okay.
Yes.
So now I will just submit my CV to newsbandtvg@gmail.com.
Yes. And if they look at your CV, they see what you are applying for. If they have that, if you have the qualification that they feel they can assist you with, then they will ask you, this is the fee. If you pay, they go on assisting you. It is not a scam. It is something that is open. They will tell you, this is what we will do for you. If it's something they cannot do for you, then they will tell you, sorry, we cannot help you here. I understand there's also one that if there's someone they are not within their power bed, they can simply give you information. There is one that there are some that are refundable and there are some that are not refundable. Everything will be explained.
Okay. It's a nice one then. Thanks very much, sir.
Thank you. Ewa, please. Ewa Ire. Please unmute. Ewa. Oh yeah, Jesu, please unmute yourself. One question I have here is, so is a public health inspector not included in the needed category? Public health inspector. That is not what, it is not within the remit of these Newsband partners now. But that doesn't mean there may not be others that can employ you. Like I said, if you send your CV, they look at the list of companies that they have. If there is one that can employ a public health inspector, they will now contact you and say, hey, Nandi or John, look, we have a company here that is looking for a public health inspector. We can help you to apply to them. This is what you will pay. If you don't hear from them, simply know that it means that they're not able to help you. But if they'll help you, they will contact you. If not, they will not. So simply send your CV to that email address that I've given you. Good evening, boss. Please, can someone get approval document from the school to show that it was not in English as regards to IELTS? No. The only evidence accepted by British government to demonstrate your knowledge of English language is that IELTS exam and nothing more. Unless you can apply to NARIC, you send your certificate and your transcripts, and NARIC can now tell you, okay, this is the equivalent qualification in the UK. If you can do that, then you are fine. For instance, for me, when I wanted to study here, I applied to NARIC. That was then a long time ago. I got my CV, my transcripts and certificates from Nigeria, sent it to them, and they validated it and gave me a NARIC certificate to say my certificate in Nigeria where I studied is the equivalent of a first degree certificate here. If you have it, then you don't need to take IELTS exam again because you have already shown that you have instructed in English language. Zachariah, please. Unless I'm wrong.
Yeah, good evening all.
Good evening.
Yeah, my name is Zachariah Akumbi. I just want to ask a quick one. Now, for someone, I'm a laboratory technician by profession.
Yes.
And from the list of professions you listed, I think the laboratory technicians are eligible.
Yes.
Now, the question is, now, for a laboratory technician who has not been able to renew the license for the past 2 years, is your license one of the major criterion for that?
I'm not really sure that. I'm not sure that for a lab technician that license it may help. Those I know that talks of license is nurses and midwives, but for a lab technician, I don't have that information. Unless you want me to check that, I don't have that. I don't have that information. So I would like to give you a wrong information. I think there is some noise. Is that me? Hello, is there a noise from somewhere?
Oh, you're just on the line, please.
Sorry? Oh, you just go ahead.
Thank you, sir. Can auxiliary nurse can apply?
Yes, that's why auxiliary nurse is equivalent of a healthcare assistant.
Okay. I can send the CV to Newsbound.
That email address, yes.
Okay. Please, another thing is that there's a hospital portal. Can they also apply that work at hospital, assisting nurses to carry patients inside the ward and X-ray?
Well, the person can only apply as a healthcare assistant.
Okay.
Yes, he can apply as a healthcare assistant.
Okay, okay. He can also send the CV to...
Yes.
Okay, okay. Thank you so much. Thank you so much.
Right.
I'm also a travel agent. There are some people that don't have privilege I have to contact you people and talk to you people. How can I be a partner with Newsbound?
Contact me later on.
How can I contact you, please?
I think I provided a contact number here, a WhatsApp number here. Ask the person you want to speak with Newsbound, and they know how to contact me.
Okay, okay, okay. Thank you so much. God bless you.
Right. iPhone 7. Quickly, we have 3 minutes remaining.
All right, sir. Good evening, sir. And
good evening.
Sir, please, I have a question because I just joined the Zoom meeting today. I studied Science Lab Tech, and my area of specialization is chemistry. So I want to know if I'm eligible.
Well, you mean if you're eligible to apply to work as a healthcare assistant, or?
Yes, healthcare assistant, sir.
Yes, like I said, anybody is free to apply to come and work as a healthcare assistant. But I have already also explained that the way you work in the UK is that you must really like that job to succeed in it.
Yes.
So if you are an engineer, ask yourself, can I work as a healthcare assistant? Because if they give you this visa, you are only coming here to work as a healthcare assistant. You cannot come and work as an engineer. For you to come and work as an engineer, you have to make application again, ask the Home Office, get another company to employ you, then apply to Home Office whether they can change your visa from this one to this one. They cannot just simply because you're in the UK, you have a visa to come and work as a healthcare assistant. You cannot go and work somewhere else. You can only work for the company that gave you visa, no other company at all. If you want to work for another company, you have to go back in Nigeria or make another application for approval. So ask yourself whether as an engineer or a lawyer or anything, whether I really want to work as a healthcare assistant.
All right, sir. All right. Thank you, sir.
Thank you. Galaxy S7. Okay, is that you? Okay, go ahead. Okay, go ahead.
Good evening, everyone. Okay, you almost answered all the questions I wanted to present. Actually, like you said, my area of career, is not really in the health line, but I'm into health safety and environment. Um, Perhaps I could apply as a healthcare assistant, like you explained. But my wife is a nursing, have a diploma in nursing. She studied in Cameroon, registered with Cameroon Nursing and the Midwifery Association.
Yes.
So I would really want to know if
it's better for your wife to apply to come and work as a nurse, and then for you to be in that application as the husband, and then they'll give you visa as the husband of the nurse, so that when your wife comes here is working as a nurse, you can now go, you are free to go and apply to work in any field. But it's only your wife that is restricted to only be given the visa to come here and work as a nurse.
Yeah, so that is just what I
Yes.
want to clarify. I already sent her CV to Newsband email.
Okay.
That was like 3 days ago.
Yeah. Let her wait. She'll be contacted by next week once everything is in place, because they wouldn't start simply like to contacting people, collecting money while they're not ready to work. So they are waiting to make sure that everything is in place. They have all the information, and then for them to start contacting people they would like to assist.
And finally, I would want to know if, like you previously said in the last meeting, that was the first Zoom meeting, that you are going to provide the companies, and here now you say you guys will make perhaps make the application or contact the companies once a company needs, find any application or CV eligible, they will contact the person. So how do we go about that?
No. Get me clear. When you send your CV to Newsband Partners, they will look at your CV and see whether they have companies that will employ you, because they are not the people employing at this moment. Now, they are not the people giving the job.
Okay.
But in the next 8 weeks or so, in the next 2 months, then their own partners will be ready to start employing. So in that case, if they are telling you, we will give you a job, then know that they will give you a job, because this is the partners they are working with. But that one is not ready yet.
Okay.
What is ready now is for them to give you the information of people who are employing certain categories of workers and their contact details, and assist you to apply for them to give you a job to get certificate of sponsorship. That is where it ends. So that you wouldn't be confused and start to say they promised you this and they didn't deliver. If you want for them to give you a job, then you have to wait, because their own is not ready yet. But there are other companies who are employing, and they can help you to apply to those ones to see if they will give you a job.
So they are the people that will help to apply to those companies are employing now, right?
No, they will assist you to apply, because last time I explained that there is what we called World Health Organization Code of Guidance that puts a country like Nigeria, if you're calling from Nigeria, and Ghana and Kenya as areas with very low density of healthcare workers.
Yes, I remember you said that.
Yes, and so the ethics of employment forbids them from targeting to employ doctors and nurses from Nigeria. So you can only get that by you applying by yourself. So that doesn't stop you from applying to a UK company, a UK hospital to employ you as a doctor. But if an agency target, like I am now, I start recruiting people from Nigeria to come and work in the UK, that means I'm going against the World Health Organization's Code of Guidance that have been approved by UK government. And so I'm not allowed to do that. So you only have to apply by yourself. They will assist you to give you all the information you need for you to apply for that company. And if that company gives you a job, they'll give you a certificate of employment. Armed with that and your international passport and other requirements, you go and apply for a visa. Am I clear?
Yeah. I got you. You're clear.
Thank you.
clear. Yeah.
All right. Infinite Hot 5 device, please. My time is up. I'm only paid to do this for 1 hour. Bola, please. You can unmute yourself.
Okay.
You muted yourself again. Unmute yourself, please.
Okay. Hello, can you hear me now?
Yes, I can hear you.
Yeah. Well, I am very happy meeting you. This is my first time. I just got this link being shared on a group. I decided to go in. I have a daughter that I'm planning that shows highly interested in this. I've tried to link her, but she's not online yet. So please, she has been working in an hospital. She has sociology. She did sociology. She had BSc in sociology. But you know the story of Nigeria now. She has to be working in the hospital, and she has been working as an health assistant for some years.
If anybody working in a hospital has an advantage. Once that hospital can confirm, give her a reference letter to say that you have worked here.
Yeah,
then
he has the reference letter and everything. He has the employment, the promotion letter and everything.
Then that person has a very high chance of getting this job offer.
But the issue is I entered late. I don't know who to contact. I don't know how to go about it. I only met what I met you guys talking while I entered.
Well, I'm happy that this thing is being recorded. I've already shared the YouTube link. Yeah, let me share it again. So this thing is being streamed live on YouTube as we speak. So you can always go back to that YouTube to listen, and all those information will be there.
Okay.
I've shared the thing again.
So then how do I link you up on WhatsApp, please?
I have given a WhatsApp number as well.
Then I will be able to link up with you directly?
Once you ask me, ask them that you want to speak with Daniel. If it's something they feel I can answer, then they will let me know. They'll give you my contact.
Wow. That means they might not link us up.
Well, because a lot of people, if I tell you the number of messages they're already receiving on this, you'll marvel.
I understand. But if I can have your direct email, perhaps I can talk to you if you would like to share your number with me.
Like I said, this thing is being streamed live on YouTube. So once I mention it here, that means it's on YouTube.
Okay.
Contact the number I've given here, and they'll have access to me. Don't worry.
Right.
Just ask them you want to speak with Daniel.
All right, I'll do that. Thank you very much. I appreciate it.
Yeah. Rachel, please. Rachel and Infinite Hot 5, then we conclude the next 3 minutes. Rachel.
Okay, good evening. Thank you for this opportunity.
Yep.
So I'm actually a midwife here in Nigeria. Though I've been trying to apply, I'm a registered midwife in Nigeria. I've been applying, looking for jobs in the UK, but it's been very difficult to locate one due to agencies not being able to recruit actively from Nigeria.
Yes.
So going through an healthcare assistant, I feel is also a way.
Well, why would you go for, if you are already a registered midwife? Look, if you are a qualified nurse,
yes, and
a qualified midwife, I suggest send your CV, and they will contact you, and then let them assist you first. Instead of degree, that is, instead of how do it's not degree. Let me not use degree. Instead of moving yourself down from midwife to healthcare assistant. I assure you will not enjoy it. Because people think that if you have not come to the UK before, you say I'll go to the UK and work. But I assure you that if you're a qualified midwife,
yes,
and you come to the UK and they employ you as a healthcare worker, within 1 year, you will start feeling very bitter and very angry, and you will not do that work well. That's just the way it works. You will not be happy because you will feel, you see yourself doing a job that you are overqualified for.
Yes.
Yes, unless you are saying, okay, let me first come to the UK, start as a midwife, and then reapply again to work as a midwife. Then, anyway, not everyone is like me. Maybe it may work for some people, but think carefully about it. If you're a midwife, patiently work to come and work as a midwife. It will take time. You may even pay some, it may even cost you some money, but walk through that route. I think it's better for you.
Okay, please, can I get the email address? Because when it was given earlier, I haven't joined then, please. So I can send my CV.
I'll get it again.
Hello?
Yeah, hang on, it's coming.
Okay.
All right, final question, Infinite Hot 5.
At gmail.com.
Infinite Hot 5 device. If you're not here, then we call it a day. Thank you very much for attending. Is Infinite Hot 5 here, or has he left? Can you unmute yourself? All right, thank you very much for joining our program. You can view the program again via the link I've shared on YouTube. And please like our YouTube channel. Thank you.